Oh, hello there. I didn't see you. I'm Alfred. So, you need to have your wisdom teeth removed. I'm going to give you a quick overview of oral surgery with Dr. Glenn. Write down any questions you might have. Afterwards, Dr. Glenn will be in to answer your specific questions. Ah, there you are. That's you being told you need to have your wisdom teeth removed. Let me explain what all this fuss is about. Open wide. A little wider. Thank you. Ahem. The jawbone reaches adult size by the mid-teen years. Your wisdom teeth typically come in after your jaw has stopped growing. Sometimes there simply isn't space for them, or they are coming in at an improper angle. It's geometry. If your wisdom teeth haven't erupted fully and are not able to adequately be cleaned, they pose risks to adjacent teeth and gums, and generally become more difficult to remove as you age. If the space behind your lower second molars isn't large enough for a tooth and a toothbrush, it's wise to have your wisdom teeth removed before they develop completely. Before your teeth are removed, you will be given the option for the use of general anesthetic, allowing you to sleep comfortably through the procedure. And now you're here. You've got empty sockets where those wisdom teeth used to be, and they'll be healing from the bottom up for 4 to 6 weeks. Food will try to hide in those sockets when you eat, especially the lower ones, due to gravity. So for 1 to 2 days, stick to foods that flow through a strainer. After that, you'll be able to transition back to your favorite foods. You will be given a small syringe to clean your sockets. Try to get the tip of the syringe all the way into the base of the socket. If you can irrigate from the base, rather than from above, it will be a lot more effective at removing food debris. Warm salt water often feels better to irrigate within the first week or so while things are tender. But then you can switch to tap water. Use the tip to gently maintain the diameter of the opening of the gums. The diameter should be similar in size like that of a number 2 pencil. You should do this a couple of times a day, but if there is something in there bothering you, like a pesky lima bean, by all means, go get it. Keep using the syringe until there is no longer a hole, which should be 4 to 6 weeks. If you do this, you will all but eliminate the risk of infection. If cleaning is not self-explanatory, come back and Dr. Glenn will give you a quick tutorial. Pain and swelling will typically take 2 to 3 days to increase and plateau before improving. If we take 100 teenagers and young adults with similar wisdom teeth and remove them, they will all recover at a different pace. If you look at a bell curve, the majority will feel better at day 4. That's an average. Adults take longer to heal, while younger children typically recover faster. Some, on the left side of the bell curve, will feel better in less than 4 days, but some people's pain will drag on for a week to 10 days, even when they are nice and have easy teeth. These folk on the right side of the curve will be experiencing what is commonly known as dry sockets. But please note that dry socket is not a diagnosis. It's simply a term that means pain is lasting longer than 5 days. It isn't something you can trigger or prevent. In the meantime, taking ibuprofen 4 times a day with meals and before bed with a little snack will help the pain. Stay on ibuprofen for 4 to 5 days, even if there is no complaint of pain. This scheduled dose is more effective in controlling the pain than waiting for it to hurt. If ibuprofen is not sufficient for pain relief, prescription medication may be taken in addition, between or staggered with ibuprofen doses. Now get back to life, and if you're lucky, they won't grow back. Just kidding. They won't grow back.